want to show you one. Let me see if there's a close-up picture. Maybe this one. If you look up here, the heart's right here. And this big major vessel right here is the superior vena cava. The superior vena cava branches into a right subclavian vein and a left and right brachiocephalic veins. Now, there's a difference in the human body between the brachiocephalic arteries and veins. There's two brachiocephalic veins, right and left. There's only one brachiocephalic artery. It's the same in cats, by the way, not that you really care, but there's asymmetry there in the body. So two brachiocephalic veins, left and right, but only one brachiocephalic artery. Okay. But for the most part, the names are the same. You got a renal artery going into the kidney, you got a renal vein right next to it. Iliacs, arteries, veins. It will be important for you, however, next week on the exam to make sure that you designate on your test if a question asks name the vessel. I'm not gonna give it away. You should know me well enough by now to know I'm not gonna say name the artery labeled A or name the vein labeled B. It'll be named the vessel, but it will be important for you to put an A for artery or a V for vein. And in some instances, it might also be important to specify right or left, because there's like right subclavians, left subclavians, right common carotids, left common carotids, things like that. And you'll see that tonight actually on the cats. Yes? Oh, okay. Good. The jugulars and the carotids, they're different. Carotid arteries, jugular veins. You can see they're both up in the neck. Obviously, any injury to these major vessels is going to cause death quite quickly because the volume of blood lost is going to be huge. And of course, where are they supplying blood to? Well, right up here to the good old brain. Right? Remember, God, now you got to remember. Remember in the, we were talking about bones like months ago, it seems like now, the cervical vertebrae have that little hole, the transverse foramen. Now, the reason that foramen is because the vertebral artery and vertebral veins actually run up through there and then go up into the brain. I don't do anything with brain circulation. Many of my Luz probably does. I know some of the other anatomy instructors do, but I don't do anything with brain circulation. I've never had any complaints about it. So. The longest vein, well, just trivia in case you're ever on Who Wants to Be a Millionaire or something like that, or Jeopardy or something like that, but the longest vessel here in the body is this one, the great saphenous, or also called saphenous. I call it saphenous, but anyway, see the big long one branches off way up here and it comes way down here. So really, basically as long as your leg is. Nothing there. These are just ones you can find yourself. These are ones in the back. You can find these yourself. Oh, yeah. Two final things here. One has to do with the liver, and the other has to do with your babies, whether you've got any or not. Actually, yeah. Just think about that now. So this will be a good one tonight for. Okay. So a portal system. You need to know about a portal system. A portal system is two capillary beds put together, and it's unusual in the human body. There's actually two, and the other one's up in your brain, and you're not going to learn about it. But here's the deal: when we get to the digestive system, the liver, your liver, is the processing organ in the body. So anything you put in is going to get into the liver. And how does it get there? It gets there through something called the hepatic portal system. So digestive material is absorbed from your guts through one capillary system, and then it's delivered to the liver by a second capillary system, and that's a portal system. And it happens to be liver, so it's hepatic, because hepatic means liver. So whenever we get two capillary beds hooked together, it's a portal system. And the important one in the human body is the one that feeds the liver, basically. So there's three large veins here: the superior, inferior mesenteric, and the splenic vein, which help form the hepatic portal system. And I got a picture. The next picture will show you how this works. So you do have to remember about the portal system. So here's how it works. So here's the capillaries which line our intestines, which cover our intestines. And they absorb nutrients out of your intestines, which you just ate. And then they feed it to something called the hepatic portal vein, which then feeds into the liver to a second capillary bed where everything is processed by the liver. And then the processed blood is returned into the venous side of circulation through the hepatic vein. So you've got two capillary beds linked together, and it's called a portal system. Now the picture, I think this is it, yeah. So here's guts. Here's the inferior mesenteric vein. Here's the superior mesenteric vein. Here's the splenic. They drain all this area of the thoracic cavity, all the the guts of your body. Everything is absorbed out of there in one capillary system. See, they all join together right here, right, to form the hepatic portal vein, which goes in, processes, and then the hepatic vein drains. So a portal system, two capillary beds hooked together. And the liver is the recipient of all of this. So anything you put in your body, the liver is going to deal with. We were joking last night, it must have been about 9 o'clock last night, there were a few of us still here, we were talking about various kinds of food, like chicken liver and gizzards, I don't know, chocolate meat, all kinds of stuff. And I made the mention that my mom made me eat liver when I was growing up. Thank goodness I had a dog that could sneak it off to. And liver's basically, as far as I'm concerned, toxic waste. Because it basically detoxifies everything you eat. So if you like liver, that's fine. I'm only teasing about that, but don't bring it in, please. Ted was telling me about a place that has really good chicken livers. I'm still not convinced. So.
It's the only liver I'll eat.
What?
It's the only liver I'll eat.